you want me to say hi?
Yeah.
Okay.
Hey, you.
Take one.
My name is Tom Ladas. I'm a cardiologist here at Lee Health Heart Institute, and I'm here to address some common myths about cardiovascular disease. So that's a false one. There is no minimum age where you don't have to worry about heart disease. If you follow a healthy diet, if you make sure your blood pressure is under control, if you're just being seen by your doctor regularly, these don't become more serious issues later. This one's funny. I'd like to know how many people watch scary movies instead of exercise. I mean, The Shining is always a good one. That's a pretty good scary movie. Oh, yeah. That one is false. Although you do have an increased caloric burn, but it's driven by stress hormones and it's not driven by your muscles needing to work harder because you're exerting yourself. That is absolutely false. False is a great one. The classic symptoms are chest pain, difficulty breathing, and sweating. Women often don't present the same way. The pain is typically not over where their heart is. It's a little bit more central. It can be a little bit lower. It often can get under-recognized, but just as many women die of heart disease as men. You know, it's funny because we talk about liters, so that might be true. We'll say that that's true. That is true. Your heart does pump 5 liters per minute. And oftentimes I use the analogy that your heart is basically supplying a garden hose. That's false. There is something that we call broken heart syndrome, also called stress-induced or stress-mediated cardiomyopathy. There's a real connection between an intense emotional state that can negatively impact how your heart functions. Your heart can improve with our standard medical treatments and with the appropriate cardiac rehab. So a broken heart absolutely can be mended and should be mended. That is definitely false. And any cardiac surgeon would get mad to hear that people think that they can't exercise after cardiac surgery. That's an important part of the healing process. There is no time too late to start to improve your heart health. If you haven't had the best lifestyle, if you've exposed yourself to things that can be harmful, it's never too late to get on the right track. That's false too. You can't brush off everything as just anxiety. Oftentimes what is thought of as anxiety is a heart arrhythmia. That's just a different form of heart disease. So I would not pass anything off as just anxiety. When in doubt, check it out.
That is a wrap.
All right.